My name is Nirav Shah. I'm the director of the State of Maine Center for Disease Control and Prevention. I'm delighted to join everyone today to provide an update on the COVID-19 situation across the state of Maine for today, Thursday, June 11th, 2020. We'll start with the cases. Overall, Maine CDC is now reporting 2,667 cases of COVID-19 across the state. This represents an increase of 30 cases since yesterday. Of those 30 cases since yesterday, all 30 are laboratory confirmed. To go through that breakdown, of our cases, 2,380 are laboratory confirmed and 287 are probable cases. Overall, 308 individuals have been hospitalized, and at present, 29 individuals are currently hospitalized. Of those 29, 12 remain in the intensive care unit and 5 are on ventilators. Overall, 100 individuals have passed away across the state of Maine with COVID-19, and 2,062 have recovered. That's an increase of 39 individuals who have recovered since yesterday. Since we've begun our activation on COVID-19, Maine CDC has now fielded 8,709 requests for consultations from healthcare providers and members of the general public alike. I'd like to take a second to just recognize and thank my staff, particularly the staff members at Maine CDC, who are the ones fielding and taking those phone calls on the front line. 8,709 calls just over a few months is basically 12 straight hours a day of calls with phones ringing off the hook. I'd like to take a second to recognize my staff there who are fielding those calls, directing callers to the right resources, and answering those questions on a timely basis. A quick update on some of the outbreaks in which Maine CDC has been most recently involved. At the Abbott Laboratories facility, we've continued to have very productive conversations with the leadership team at Abbott and are continuing our epidemiological investigation in trying to figure out whether any of the cases that are associated with that facility were contracted there or may have been contracted elsewhere. That investigation is underway. Similarly, at Nichols Manufacturing, the facility there is undertaking the process of collecting samples from all of the staff members and will be sending those samples to our laboratory in Augusta for testing. And finally, at the Procter & Gamble facility in Auburn, there are now a total of 13 cases of COVID-19 associated with that facility. Of the most recent increase in cases, 1 is in a staff member and 5 are among contractors that have visited the facility. I'd like to take a second to provide an update on some of the vital statistics that Maine CDC tracks on a daily basis. Overall, there are a total of 397 ICU beds across the state, 153 of which remain available. There are a total of 318 ventilators, 258 of which remain available, and there remain available 441 alternative ventilators. Maine CDC's Public Health Emergency Preparedness Program has continued its delivery and push out of swabs and viral transport media to healthcare providers, doctors' offices, and clinics across the state. So far, Maine CDC has fulfilled 153 orders for swabs and viral transport media, comprising 74,237 swabs and vials of transport media. Again, these are vital elements in the overall chain of pieces of supply that are required for testing for COVID-19. We're continuing to push those supplies out as soon as we get them in. In addition to swabs and viral transport media, our colleagues at the National Guard have continued their fit testing activities. Just yesterday, they fit tested 147 staff members at 3 separate healthcare facilities across the state. Today, they're on track to fit test 120 staff members at 2 separate healthcare facilities across the state. By the end of today, 2,200 staff members, 2,200 healthcare staff members will have been fit tested across the state, comprising 76 total fit testing missions. And as always, our colleagues at the National Guard show no signs of letting up because they have several more hundred people on their list as they continue their fit testing work. I'd like to next provide a quick update on some of the metrics that we track on a daily basis with respect to how we're doing on testing. Cumulatively, across the state of Maine, there have now been 65,939 PCR tests for COVID-19. As a note for everybody, we specifically focus on the PCR test to tell us where we are in the middle of an outbreak. We also keep tabs on the number of antibody tests that have been done. That number is 5,271. The difference between those two tests is really critical. Antibody tests are sort of like looking in the rearview mirror. They tell you where you've been. The molecular test, the PCR test, the first number I reported, that's like looking out your windshield. It tells you where you're going, especially when you're in the midst of a situation like we are in an outbreak. We also take a look at just not only the number of tests performed, but the overall number that were positive and the percentage that was positive. And there again, our trend is in the right direction. Our cumulative positivity rate since we began testing in the state of Maine now sits at 4.64%. We also track the positivity rate not just cumulatively, but on a day-to-day basis. And just for the tests that were done yesterday, the molecular tests that were done yesterday, of which there were 1,523, the point positivity rate for yesterday was 2.69%. That number fluctuates quite a bit based on the number of tests and the number of positives. Our goal continues to be to drive both of those numbers as low as possible. Again, the trends are suggesting that we're heading in the right direction, but that we also simultaneously need to keep up this momentum so we can drive both of those numbers as low as possible. And finally, before we turn to our colleagues in the media, just a few notes on where things stand right now. We fully recognize that this is a time of really rapid and radical change. It seems like every single day we learn something new, something different about COVID-19 that changes the way we think about the disease, as well as something that changes our response to it. We try to share all of that news with you on a daily basis, as well as the policy responses. We fully recognize it's a bit bewildering. Like I said last week, just speaking for myself, when it comes to COVID-19, you can almost pick your metaphor and it applies. For me, it's like I'm running as fast as I can just to stay in the same place. For other people, I think they feel like it's trying to take that proverbial drink out of a fire hose. We know there's a lot of information that's coming out. We try to synthesize it and try to tie it directly to the policies that we are trying to put into place to mitigate COVID-19. Now more than ever, that communication is vitally important. And I'd like to take a moment to thank each and every one of you who have dialed in today, and for many of you for so many days now, to hear the latest on COVID-19 and stay informed. That communication is more vital now than perhaps it ever has been. And having the facts is critical. I'd like to take a moment to just reiterate a couple of resources that are available to each and every one of you in case you've got questions about COVID-19. One of the first places to go is to the Maine CDC website. We have a wealth of information there, not just on the data as the outbreak has evolved, but as well as on policy documents and other pieces of material like frequently asked questions that we try to update as often as possible. If you have a question and you don't find the answer on the Maine CDC website, the next place I recommend folks go is to the US CDC website, which similarly is trying to make sure they keep their website up to date with the latest information on the outbreak. If you've got more specific questions relevant to the state of Maine, we recommend you call our colleagues at Maine 211. They can answer general questions that you might have about COVID-19. And if you can't call, there are a number of other ways to get in touch with our colleagues at 211. You can, for example, text your zip code to 898-211 and get in contact with them that way. You can email them at info@211maine.org. And you can also, of course, just call 211 in the standard fashion. We've had a great partnership with our colleagues there, and I thank them for taking on so many of the questions that people of Maine have asked. Another new resource that has come out that is available on our website is the standing order. Now, this standing order allows a broad swath of individuals across the state to access testing, even if they might not have a primary care provider or an order from their primary care provider. It encompasses a broad group of folks that we believe to be at higher risk for COVID-19. You can find that standing order on our website. You can download it and then use it if you were to go to a sample collection site to be tested, provided that you fall into one of those broad categories that are listed on the standing order itself. I really recommend that before you go down that route, you call the sample collection site before you go. We do that, I recommend that for two reasons. The first is that one of the things that we like to avoid is the congregation or the formation of large crowds at the very place that folks are getting tested for COVID-19. The other reason is just to touch base with the sample collection site, to make sure that they're open, to make sure that they've got a time slot available for you. The one ask that I have for everyone who's watching is to please, if possible, not call our laboratory here in Augusta. We've had a number of folks call our laboratory asking when, for example, they could walk into the laboratory and get tested. Our laboratory is the site where the tests themselves are run. It's not a site where they're able to do any sample collection itself. We know that a lot of folks want to get tested, and the best way to do that among many is either to call your primary care doctor, or if you're not able to access that, use our standing order and call one of the sample collection sites before you go, and you can use our standing order provided you fall into one of those broad categories. But again, I do ask that you, if possible, not call our laboratory in Augusta. That's where the tests are run. It's not where the samples are collected. So with that, I would like to turn things over to our colleagues in the media. And today's first question goes to Megan from WMTW. Hey, Megan, if you're with us, go ahead. Your line's open. All right, we're going to come back to Megan in just a moment while we turn to Bob Evans from News Center.
Good afternoon. There is a growing concern about a new wave of COVID cases in light of the non-socially distanced rallies and protests that are going on around the state. Are you concerned about a spike of cases from those events?
So, Bob, we've been keeping tabs on the data that we see every single day with respect to COVID-19. And the bottom line answer is that anytime there's any large gathering of individuals, whether it's for a protest or for any other purpose, there is the possibility of transmission of COVID-19. Actually, one of the things that we did in the standing order was make sure we included a provision for anybody who has recently attended any large gathering to make sure they were covered by the standing order. So, Bob, the answer is yes, we were aware of that possibility and wanted to make sure we provided individuals an option to get tested as a result of that. There is a risk after attending any large gathering of any sort of the possibility that there could be COVID-19 transmission. One of the points that I really want to note from an epidemiological perspective, Bob, is that although we look at the data every day for any such possibility, there are two important observations. The first is that if we do see any sort of spike, tying it to a protest or a gathering might be incredibly difficult to do. There might be a lot of other reasons that folks may have been exposed, They could be exposed just in their community, for example, irrespective of having attended any large gathering. So directly drawing a straight line from any event to any subsequent increase in cases is a challenge. The other thing, with respect to the most recent gatherings, many of the individuals who attended those were on the younger side. They may themselves, even if they get COVID-19, may not have symptoms, or if they do have symptoms, may have only mild symptoms. So what we're actually looking for is not just a spike in those individuals, but one of the concerns we have is that those individuals may have a mild infection and then, say, for example, visit their grandparents on the weekend and then get their grandparents ill. That spike may not occur for 2 incubation periods, which is to say about 2 to 3 weeks from now. What I recommend anyone to do is that if you've recently attended any large gathering and you're not feeling well, please make sure, A, you stay inside, avoid contact with anyone who might be vulnerable, and B, get yourself tested. I'm going to turn back to Megan and see if she's able to chime in. All right, Megan, we'll come back to you while I turn to Amy Brown at WERU. Oh, go ahead, Megan. Go ahead.
I'm sorry, I was having some issues with mute and my phone. I apologize. My question is looking forward, really. I don't want to get too much ahead of ourselves. Certainly, there's a lot to contend with here. There's more work to do. However, as more things begin to reopen, as we theoretically could see more cases with people in close proximity at protests, if that's a possibility, and as more people begin to travel here, we could see a second spike at some point. And my question would be, in that instance, what are we doing to make sure that the second go around we have as much PPE as we need, everything that we need to equip everybody, versus, when we first saw this, how it was sort of a scramble to make sure that we were properly equipped?
Sure. So Megan, one really important note. We have been, as we've been undertaking our own internal emergency preparedness planning, we have been preparing for the possibility of an uptick in cases. Now, that uptick may occur in a couple of weeks. It could occur in a couple of months. It could, as some national experts have suggested, come in the winter time. It's unclear when or if such an uptick may occur. But either way, Maine CDC has deliberately taken steps to prepare for that. The second important observation, Megan, Amy, Megan, it is Megan, I'm sorry. Megan, is that even though at some points our stocks of PPE did get low, at no point were we ever out. At no point were there requests that were coming in where we had to say, sorry, our shelves are bare, we're not able to assist you. We got down close to the wire, but at this point, even before we got to this point, at no time was Maine CDC ever completely out of PPE. All that being said, we have made sure that as we have received more supplies of PPE from FEMA, as well as our own efforts to procure it, we have started to rebuild our own strategic reserve of personal protective equipment. And just to provide a quick number for you, as of right now at our warehouse, we have 295,770 N95 masks on hand. We're making sure that if that second wave were to occur, no matter when it occurs, Maine CDC is ready, not just from a PPE angle, but from an overall public health response angle. In the same way that we began preparing for the current COVID-19 outbreak way back in January, months before there was even a case in the United States, let alone a case in Maine, we're simultaneously now preparing for the possibility of another spike, whether that spike occurs later in the summer or into the winter. No matter when it happens, we'll have the machinery in place to respond. I'm going to turn now to Amy Brown at WERU.
Thank you, Dr. Shah. The 6, I think it was, people who have been added to the total for the transplant of people who have tested positive, does that represent the end of the universal testing? Is that all complete now?
The answer there is, as of right now, we are, so yes, they have undertaken rounds of universal testing. And having done so, they've identified, on top of the initial 7 cases when the outbreak investigation was opened, an additional 6 cases. What we're talking with the facility now about is what testing looks like going forward. Will it be targeted testing at for individuals who may be new to the facility? Will it be only for individuals who are showing symptoms? Will it be just a subsample of individuals? That's the conversation we're having with not just this facility, but my counterparts are having with work sites across the country right now.
Thank you. And a listener who's a dairy farmer asked us to ask you the following question. He writes, dairy farmers regularly use various forms of PPE, but finding gloves and N95s has become increasingly difficult, if not impossible. Do you have any suggestions for how businesses like dairy farms can acquire PPE since they are providing food, which is obviously an essential service?
Mm-hmm. So, Amy, it's a good question. It's something that we've heard not just from your viewer who's a farmer, but from professionals across the spectrum who use PPE as part of their day-to-day jobs. Individuals who work in industrial manufacturing, individuals who are painters, groups of that nature that rely on PPE have reported that because of the worldwide demand for PPE, they found it more difficult. We've simultaneously heard that in the past few weeks that those supply chains have gotten looser such that they now are able to get their orders filled. What we recommend doing in these situations is calling not just the same supplier you've used, but as many different suppliers as possible. Our own experience at Maine CDC has been that a particular supplier may be out on Monday, but if we call another one that same afternoon, they've got sufficient supplies on hand based on what their own internal supplies look like from their manufacturers. So our advice that we've given to individuals from across the spectrum is call early, call often, and call as many different suppliers as possible.
Thank you.
I'm going to turn next to Steve Missler from Maine Public.
Hi, thanks for taking the question. I guess I'm wondering if any of your contact tracing investigations have been able to have traced any cases back to any previous gatherings. I'm thinking some of the ones that may have occurred before the most recent ones, back in I think maybe April or May. If there's been any investigation that has yielded a link back to those. I think it's been a while since we've asked you about that, so I figured why not now?
Yep. Good question, Steve. I'm trying to think. I will check with our EPI team to see if there's any new information on that front. We have seen an uptick of cases in certain parts of the state, but it's difficult to disaggregate that uptick in cases from other activities that might be occurring as well. So, for example, uptick in cases in Cumberland County, but that has preceded any type of protest activity. I recognize that you're asking about earlier activities as well. I'll check with our EPI team to see what the latest is and whether we've directly tied any subsequent cases to any gathering. The difficulty in this situation, of course, is that causation link. A lot of times what we see is correlation, but a lot of folks that may have attended the same gathering may have also been at the same barbecue because they're socially friends, so on and so forth. So what we always find in these epidemiological investigations is a fair amount of correlation, but as goes epidemiology, as goes life, causation is much more difficult to demonstrate. We see a lot of correlations, but that causal link is a far higher hurdle to cross over. But we'll check with our EPI team and see what the latest is.
Okay, thanks.
You bet. I'm going to turn next to Brian Sullivan.
Dr. Shah, just looking at the numbers you gave us about positivity rates, and I apologize if I don't use the right terminology, but you had 4.64% cumulative and overnight or day-to-day 2.69%. And as those numbers seem like they're headed in the right direction or a good direction, and as more people or outside factors perhaps start to come into the state, I just wonder how, as those numbers, if they continue to go in a certain direction that you like, knowing that there are outside factors in terms of tourists or people that maybe we don't know, there are certain restrictions that we'd like to see in place. How will your recommendations I guess, go or differ as this starts to play out throughout the summer?
Yeah. So, Brian, one note right at the top. Although this positivity rate is an important figure, it is but one of many that we track, and we take a pretty holistic view as we're thinking of policy recommendations. So we take a look at all the numbers that I talk about every day: the number of new cases, the number of hospitalizations, the number of seriously ill individuals, the amount of PPE we have on hand, as well as the syndromic data about what kind of symptoms folks have out there. All those data are on our website. We update them quite frequently. So it's just but one piece of a larger puzzle as we're making recommendations about any type of action we might want to take. The positivity rate on its own, standing on its own, is less about whether we are in a position to, say, reopen versus close, and much more about whether our testing, are both in terms of the availability and the volume, is where it needs to be. Now, certainly there's a link between testing capacity and the ability to reopen safely. Don't get me wrong, there's a direct line between those two. But when I look at the positivity rate, the reason I look at it is less about the direct implication on reopening. That's only an indirect implication. It's more about whether the supplies and the capacity for testing out there are where they need to be. The fact that we're trending in the right direction for both numbers suggests two things. One is that testing is available. Two, that we're catching the requisite number of asymptomatic individuals, or in this case, really pre-symptomatic individuals, that we're catching people before they develop symptoms, but are still positive. So those folks can be given advice to stay indoors and not spread the disease to others.
And I had a question that we received from a viewer. I'm not sure if you can tell us, but if you could, what percentage of the people that have passed away with the coronavirus that had pre-existing conditions?
We'll check on that to see what the number is, but let's cut right to the heart of that question. There is this notion out there that what is really going on with coronavirus is, for some reason, an inflation of the numbers. And I want to just cut that right off at the pass. Every single public health expert across the country that has taken a hard look at these numbers, their conclusion almost uniformly, from Dr. Fauci on down, has been that the number of individuals who are reported as having passed away with COVID-19 is, if anything, an underreporting of the numbers, because many people may have passed away without getting tested, or may have passed away quietly in their homes and not known that they had COVID-19. To be sure, a number of individuals who have passed away did have pre-existing conditions. As Governor Mills herself have noted, that's indicative of the overall population in the United States. The things that lead to higher mortality for COVID-19 are as wide-ranging as hypertension, high cholesterol, obesity, kidney disease. These are hallmark chronic conditions that exist in high percentages, not just in Maine, but across the country. We know that for any illness, if you have a pre-existing condition, whether it's for influenza, pneumonia, COVID-19, your likelihood of passing away is already higher. But what we've seen, and according to national experts that have studied this, with COVID-19, if anything, what we are seeing is an undercounting of the number of individuals who have passed away with it, not an overcounting. I'm going to turn next to Caitlin Andrews at the BDN. Caitlin, I'm going to come back to you in a second. One additional note, Brian, to your question. The way that I think about pre-existing conditions, on top of what I just said, is as follows. This is all the more reason for everybody who's watching today to note that if you've got a pre-existing condition, if your spouse has a pre-existing condition, if anyone in your circle has a pre-existing condition, your risk of having serious complications from COVID-19 up to and including passing away is already significantly higher. That's all the more reason not to play around with COVID-19. It is a serious disease just about for anybody, But for people with pre-existing conditions, whether it's hypertension or kidney disease, diabetes, heart disease, it is particularly serious, and all the more reason to take care. So that's the other way I think about pre-existing conditions, Brian. I'm going to turn back to Caitlin at the BDN.
Thank you, Dr. Shah. One, have you noticed that up to 50 people who are from out of state who might be testing positive in the state now that it's beginning to open up more and it's tourist season? And what kind of advice are you giving businesses on air conditioning and whether there are any risks with that in spreading the virus?
So as to the former question, Caitlin, we haven't noticed any uptick of that sort. As to the latter, with respect to air conditioning, the data there are still coming in. There is at least one paper that suggested that air conditioning may have been responsible for creating turbulence within a room because of what air conditioning does, which is to blow air around, and that turbulence, that airflow, may have contributed to the transmission of the virus elsewhere. That's just one paper, however. So the science is not yet quite settled on the role of air conditioning in potentially propagating COVID-19. A related point, Caitlin, is that there seems to be an emerging consensus, maybe not, consensus might be too strong. There seems to be an increased number of scientific papers that suggest that outdoor activities are at lower risk than indoor activities. And there are numerous hypotheses as to why that might be the case. And it's possible, although we don't yet know, that one of those potential reasons why indoor activities may be more risky than outdoor activities is the presence of recirculated air via air conditioning, and that doesn't really exist so much outside. So right now, the US CDC has not made any official recommendations, but it does suggest one potential reason why this observation that outdoor activities seem to be safer might be one reason for that.
Thank you.
Yep, I'm going to turn next to Kevin Miller at the Press Herald.
Great, thanks, Dr. Shah. So I'm curious. We haven't heard too much recently about outbreaks at congregate care settings. I think on Tuesday you mentioned three outbreaks, all in single digits. I guess my question is, are we seeing things actually quiet down in nursing homes and long-term care facilities? Recognizing, of course, that an outbreak can happen at any time if something is introduced there.
Yeah, Kevin, that's I just a few hours ago was discussing this exact issue with some of the folks on our team. You correctly noted, and I will reiterate it for the record. This can change almost overnight, but it is the case that we have not seen the large-scale outbreaks that we saw earlier in the outbreak, although I will say other states do continue to experience those large congregate care outbreaks. I think a couple of things are going on. The first is many more individual healthcare workers have been fit tested. You folks have heard me talk about that almost every day. That helps. When individual healthcare workers are fit tested and wearing N95 masks, their likelihood of transmitting the virus to any of their patients goes down significantly. The other thing is, a few days ago at this meeting, we talked about some of the so-called engineering controls that facilities have put into place to limit the exposure between and among residents, as well as with different staff members. That certainly played a role as well. And then finally, more widespread access to testing, specifically testing of staff members, is sort of an early warning if something might be happening that allows us to jump into action sooner rather than later. So I think those are some of the positive signs we've seen on the horizon. But that being said, that situation could change almost overnight. We are, with respect to congregate care facilities, still not out of the woods. And I will tell you, they remain our top area of concern right now. They continue to remain our top area of concern. They always have been and probably always will be. But yeah,
great.
So, yeah.
Go ahead.
One
Kevin. Other question. So, and this is a more general question. Obviously, we're getting a lot of debate about tourist season and the testing. Foregoing the 14-day quarantine for folks who get tested. as kind of from your epidemiological standpoint, how closely are you watching what's happening in the other states where we get a lot of tourists from? So, right now things seem to be trending the right way in Massachusetts and New Jersey and New York. But if they start seeing a surge again, does that change your calculus about how we should treat out-of-state tourists? Or your recommendation to Mills about how we should treat out-of-state tourists?
The answer to both of the stems of your question, Kevin, is yes. We watch the data from other states extremely closely as we are thinking about the situation. We are, for example, taking a very close look at where things stand in Vermont right now. To say nothing, of course, of Massachusetts, Rhode Island, New Jersey, Pennsylvania, New York, other states where tourists tend to drive to Maine. That plays a very big role in our overall assessment. It's not so much about what's happening within our state. It's really, in this interconnected day and age, it's just as much about what's happening in other states. There have been some declines in the number of new cases reported there, but they still remain on a percentage basis significantly higher than the state of Maine. One reason Governor Mills wanted to be especially protective is the fact that we in Maine, through the efforts of every single person watching right now, have done a great job. We should all be proud of the job that Maine people have done to keep our overall case rates low, our fatality rates extremely low relative to other states. And in concert with that, one of the reasons the governor wanted to be especially protective is to keep things that way. Unfortunately, just about every one of our neighbors, perhaps save for Vermont, has a higher case rate than we do. Some are a little higher, like New Hampshire. Others are much significantly higher. And if they start trending back upward, that's going to be a signal for us to rethink things.
Thank you.
You bet. I'm going to turn next to Patrick Whittle over at the AP.
Thank you very much. Speaking of New Hampshire and Vermont, there's been the state is sort of has kind of a little bit more open borders with New Hampshire and Vermont than it had. I'm curious if there are any other ways that the three states are sort of working in concert as sort of a super state in the way that many states are doing right now. And also, I'm curious if there's been any discussions with the provinces of New Brunswick and Quebec, because I know there's not a lot of cross-border movement right now, but they are right there. So I'm curious if the governments are cooperating in any way.
Yep. So Patrick, as to the super northern New England state, there's a lot of collaboration and cross communication that occurs. I have a fair number of calls with my counterparts in those two states to talk about what we're seeing in terms of data, new cases, things of that nature. I know that Governor Mills does as well, obviously with the governors of those two states. We've tried to coordinate as best we can, recognizing again that even relative to those two states, well, Maine's rates are comparable to that in Vermont and even in lower than that of New Hampshire. Hence our desire to be as protective as possible. But there's a lot of collaboration and an attempt at harmonizing policy across those states. With respect to the Canadian provinces, there have been discussions across the administration with our respective counterparts in New Brunswick, Nova Scotia. I haven't had any conversations with my counterparts in Quebec, but with the others. But as of right now, as you noted, the border remains closed. But we're preparing for the possibility that Prime Minister Trudeau may go in a different direction, the same with the federal government here. So we're preparing for that possibility. And we would apply the same calculus as we do with the other northern New England states, as we would with, say, the maritime provinces relative to Quebec, where the case prevalence rates are pretty significantly different. Nova Scotia, New Brunswick, significantly different from Quebec with respect to the number of new cases on a daily basis. And we would take that into account as we're thinking about our own policies. And the last question for today goes to Joe from ABC7.
Thank you, Dr. Shah. Just looking for a quick update. There's been a lot of things out there about the antiviral drug remdesivir. And I just was wondering about, there's been some officials saying that if we do see a spike and this drug starts to get used more and more, that we may not have the proper supply for it. And I know it hasn't been approved whatsoever, but was wondering if there was any update on the drug and if you and your team have looked into any other drug going forward.
Sure. Joe, we actually do have some numbers. I don't have them. We'll get you the exact numbers of what we've received versus how much remdesivir has been used in the state, at least as it's been reported to us by the hospitals. We do have some of those figures, and so we can furnish you with those. Now, in terms of, and there has been use of the drug in Maine. As folks are aware, we've, starting about a month or two ago, started receiving shipments of the drug from the federal government and have distributed those to hospitals across the state. Clinicians across the state have been using remdesivir in COVID-19 patients statewide. Now, in terms of other drugs, there are other drug candidates that are being studied right now, but none of them has reached the stage at which the US FDA or the US CDC has put their seal of approval on them yet. So we at Maine CDC haven't taken that similar step and recommended other therapies. Remdesivir is the one drug where there have been clinical trials that have shown some benefit. The benefit there and the value of that benefit is still under debate in the medical community. It seems to reduce the number of days that individuals are hospitalized for, but it may not really do much in terms of sparing people from the worst side effects of COVID-19, for example, passing away from it. So there's some good news on remdesivir and then some more science that needs to be done. In terms of other drugs, again, we are continuing to work with our national colleagues to keep tabs on where the scientific research is. If and when new drugs get discovered or new uses for old drugs become uncovered that could be useful, we'll make sure and communicate that to doctors across the state.
Thank you.
So thanks for that question, Joe. So with that, everyone, I'd like to wrap up today and take a moment to thank everyone who has really taken so much time out of your own days for the past now almost 3 months, tuning in every single day to hear the latest across the state. I applaud you for your desire to stay informed. I pledge to continue trying to make sure that we provide timely, accurate, complete information on the state of COVID-19 statewide, no matter what form that takes. So I continue to urge everyone to take a look at the Maine CDC website for the latest information. If you don't find what you're looking for there, please take a look at the US CDC's website. And if you've got specific questions, our colleagues at 211 are standing by. But again, I do thank everyone for taking time out of your day, every single day, to tune in to hear the latest about COVID-19. We very much appreciate your interest, and we thank everyone for your time. I hope everyone has a great afternoon. Be healthy, be kind, and take care of one another. We'll talk tomorrow.